An implant can be done in one day, and sometimes an implant can have a crown put on it the same day that the implant is put in. But implants are placed in bone, and it takes bone usually several months to completely heal, as well as the tissue or the gums around it. So while an implant can be done in a day, and implants can be loaded or a crown put on them that same day, often it's a several month process. Short answer is no. Long answer is floss is sort of like a toothbrush for in between your teeth. So sometimes the slippery floss like Glide or others like that isn't quite as effective at removing plaque in our experience. But I say any floss is better than no floss. So I expect people to floss regardless of what the commercials say.
I think floss is a personal preference. I can tell you my favorite is the woven. This one just feels like it gets in between and cleans a lot better. It's like a little thicker, but some people need to use like a Glide, like a waxed floss, so they can get in between a little easier. If their teeth are really tight together, they're gonna wanna use something that's a little bit easier to slide through. But there's also like these little flossers that work really good too. As long as you're getting in and flossing with anything is better than nothing. So whatever you like.
The amount of radiation that is received from dental x-rays is far exceeded from background exposure, flying on airplanes, and other daily exposures to radiation. But we're very careful regardless, and we only take x-rays as needed and as required by law. So when you come to our office, everything's digital, which is a significant reduction in radiation exposure. And also we use the latest technology for cone beam scans, which can also reduce exposure for full mouth series of x-rays. I recommend you use a toothpaste you like. A toothpaste that tastes good, that you're comfortable with. Frankly, you don't need to use toothpaste. If you want to get your mouth clean, you can do that with floss and brushing and no toothpaste. In fact, the periodontist generally will recommend to his patients not to use toothpaste because toothpaste can be very abrasive and can increase recession. That said, get a toothpaste that's got the ADA seal on it, that has fluoride in it, and you're pretty much good with whatever's out there. Frankly, by the time a tooth starts hurting, the cavity is probably very deep and may end up needing a root canal or may need to be removed. So the fact that it's not hurting isn't necessarily an indicator of health in the tooth. And so I just say, when I recommend doing a filling, it's because there's decay or a crack in the tooth.
Well, the cavity starts in the enamel. If it goes into the dentin, it's going to start getting a little bit deeper. And then if it starts to hurt, you're going to be looking at a little bit more than a filling. You may even need a root canal and a crown at that point. So if your dentist or your hygienist say that you've got a cavity, you want to take care of it before it starts to hurt. I would say they are dangerous if you get a tongue piercing or something. Well, I guess if they're metal more than anything, because they could break your teeth. I think they make plastic piercings now. Still have a chance of breaking your teeth, and that could end up costing you lots of money and a lot of pain.
Oral piercings aren't as bad as some people think, but they're not good either. I regularly see people who have oral piercings and have cracked and broken teeth, and very strongly correlated to the jewelry that they have in their mouth. So I tell people, if you're going to do an oral piercing, number one, keep it clean. Number two, keep it plastic. The plastic oral piercings are a lot safer than the metal ones. Chewing tobacco isn't good. There's a correlation with chewing tobacco and oral cancer, but it's also not as bad as smoking tobacco. So I tell people it's best if you quit. Most people know that, but it's also very, very difficult to quit, so it's best to never start. Chewing tobacco increases cancer risk, and we screen for that every time that you come in, but I'm also not going to lecture you. A lot of people know that it's not good for them and they do it anyway, and that's okay, as long as they're aware of the risk. Anyone can get their teeth whitened as long as their teeth that are visible aren't crowned, aren't dentures, and aren't full of fillings. Crowns, dentures, and fillings won't whiten. We can replace the crowns, we can replace the fillings, and we can replace the dentures, but whitening per se will not work for those people. Other than that, I've had people in their 80s do whitening, 70s, 60s. So there's no age limit. I probably wouldn't do any whitening on somebody younger than 15 or 16 years old. If you're pregnant, we pretty much avoid everything, just because we don't want to risk interfering with pregnancy, interfering with fetal or embryonic growth. So we say it's best just to wait until you're not pregnant or breastfeeding. But what fluoride does is it strengthens the enamel so that the enamel is more resistant to the acids that we eat, and so it makes the teeth more resistant to decay. I think the misconception with fluoride comes from how fluoride is produced and how it's made on an industrial scale. A lot of people are not comfortable with it, not comfortable having it in their drinking water, and which is fine. The research is pretty clear on fluoride and the benefits of fluoride, but if somebody's not comfortable with it, that's okay. You know, there are other things that they can do to negate the effects of decay. My favorite thing to do is a smile makeover. When I get somebody coming in who doesn't like their smile, doesn't like the way they look, tells me that they don't smile in pictures, and they come in and we do treatment to improve their smile, whether it's as simple as just whitening their teeth, smoothing off rough edges, or doing a full mouth makeover. That's my favorite thing, is when people come in and we can help them smile. My name is Dr. Lauren Anderson from Anderson Dental, and I approve this message.